Hello everyone, this is Ankita from CRM Billing and welcome back to my channel. Today we are going to talk about revenue cycle management in US healthcare. So what is revenue cycle management? It is basically a step-by-step guide from where the patient books his first appointment until your doctor or practice receives full reimbursement for the claim. So this is a standard cycle. It is being used by all the clinics and the doctors in USA so that they can get the quicker reimbursement, and this is a standard process they follow. This revenue cycle management is consist of following steps. Very first one is patient scheduling. Then we have insurance eligibility verification. Then third one is patient demographics entry. Then we have medical coding. Then we have charge posting or medical billing. Then the claim submission. Either you can do it electronically or paper. Then the next step is to uh, post the payment. Here you basically receive a correspondence from insurance and then you post the payment. After that you work on any denials or any appeals. Then you send a patient statement and the final step is reporting, and again you start with the patient scheduling for the new patients. So this is how the cycle goes. Patient scheduling is itself is a very vast topic. However, we will just try to cover some basic points here. So, what is patient scheduling is? Let's say a patient wants to have an appointment in upcoming days, and he wants to come to the clinic at the certain time or at a particular time. So, what patient can do is either call the clinic and request him to book an appointment for that particular time, or let's say if it is a follow-up visit, then the clinic staff calls the patient proactively and confirms the appointment. So this is just a very superficial level of patient scheduling. Patient scheduling is very important to avoid the patient's inflow, and this also requires to improve the patient satisfaction, because with the rise of patient volume including the arrival of unscheduled clients, so that sometimes becomes a very stressful and unrewarding task, and that is why we need to do the patient scheduling. In the patient scheduling, as I mentioned earlier, that this is very vast topic, and sometimes you will also come to know that okay, this is a new patient and this is a follow patient, so this kind of terminologies will be being used, and you need to understand what is a new patient and the follow-up patient meaning, and you will learn this in upcoming videos because we are keeping the revenue cycle management chart video very short to get the basic understanding of it. Insurance eligibility verification is basically the verification of members' insurance information, and it is to be done in order to validate the patient's active insurance coverage and to find out the patient's if there is any patient's liability. What does this mean? So basically, let's say there is a patient who is a walk-in patient to the clinic, and he wants to have a general checkup. However, his policy is already terminated or is already cancelled before his visit date, which is today. So, if his policy is already cancelled, the doctor won't be able to send the claim to his insurance company, and doctor might not get paid, and that is the reason it is a very important task to do the insurance eligibility verification before doctor sees the patient, to make sure that patient does have active insurance policy, and the charges which doctor is going to bill to his insurance company will be covered. So it is very important to have an insurance eligibility check done prior providing services to any member. Now there is another important part is prior authorization. So, what is a prior authorization? So, prior authorization is basically a process that requires approval from health insurance plan before providing a specific service or medication to patient. Now, why it is important? It is important because we need to doctor need to make sure that the services were medically necessary and those are actually covered in patient's plan, and that is the reason doctor also needs to check if any prior authorization is required for the services he is going to perform on the patient or no. The prior authorization are usually on the provided on the high dollar value cases like surgeries and some of the medication. Prior authorization is also performed when also requested when doctor is not in the patient's network. So these are actually two different things which we will learn in upcoming videos again. But always remember that whenever you do the eligibility verification check, you also need to check if there is a prior authorization is required for that particular procedure code. So that's the other important thing you need to keep in mind. The next step in the revenue cycle management chart we have is patient demographics entry. So patient demographic entry meaning basically, so what comes under patient's demographics? So patient's name, date of birth, patient's address, these kind of information comes under the patient's demographics, and that all the information needed to be entered in clinic's software by a front desk or a clinic staff, and that particular entry of adding the patient's information in the software is known as patient demographic entry. Now, why this demographic entry is required? So that patient doctor have all the details of the patients. You know, he have his phone number, he have his correct name, his mailing address, his insurance information, member's phone number, just in case doctor needs to reach out to him or any clinic staff needs to reach out to him. So that entire entry is being entered in the patient doctor's software. The other reason to have the demographic entry done in the software is for the billing purposes. Whenever the claim goes to insurance company, we also need to include the patient information, so that way insurance company can identify a patient, and that is the reason it is important to have the patient all the demographic entry details added into the doctor's software.